Welcome to today's video lecture on fibromyalgia. Before we start, don't forget to check out our website madeformedical.com for hundreds of more videos like this at the end of this video. The link is in the description. In this session, we will explore the complexities of fibromyalgia, including its clinical presentation, etiology, diagnostic criteria, and management strategies. By the end of this lecture, you will have a comprehensive understanding of fibromyalgia and be equipped with the knowledge to provide optimal care to individuals with this condition. So, let's begin. Fibromyalgia is a chronic condition characterized by widespread musculoskeletal pain, fatigue, sleep disturbances, and cognitive difficulties. It is considered a disorder of pain processing, where the central nervous system amplifies pain signals, leading to increased sensitivity and pain perception. Fibromyalgia is often associated with other symptoms such as headaches, irritable bowel syndrome, and mood disorders like depression and anxiety. The exact cause of fibromyalgia is unknown, but it is believed to involve a combination of genetic, environmental, and psychological factors. It may be triggered or exacerbated by physical trauma, infection, or significant psychological stress. Fibromyalgia is more commonly observed in women than men, and it can occur at any age. The pathophysiology of fibromyalgia is still not fully understood, but research suggests several mechanisms that contribute to the development and maintenance of the condition. Here are some key aspects of the pathophysiology of fibromyalgia. Central sensitization. Fibromyalgia is believed to involve central sensitization, which refers to an abnormal amplification of pain signals in the central nervous system. This results in an increased sensitivity to pain and a lowered pain threshold. Various factors, including genetic predisposition, neurotransmitter imbalances, and abnormal pain processing pathways, contribute to central sensitization. Neuroendocrine abnormalities. Disturbances in the neuroendocrine system, including alterations in the levels of certain neurotransmitters and hormones, have been observed in fibromyalgia. Serotonin, norepinephrine, and dopamine imbalances are commonly implicated in the regulation of pain, mood, and sleep, which are affected in fibromyalgia patients. Abnormal pain processing. Fibromyalgia patients often exhibit an altered pain processing mechanism. There is evidence of increased pain-related activity in the brain, changes in pain modulation pathways, and alterations in the descending inhibitory pathways that normally help regulate pain perception. These abnormalities contribute to the heightened pain sensitivity experienced by individuals with fibromyalgia. Sleep disturbances. Sleep disturbances, such as non-restorative sleep and disruptions in the sleep cycle, are commonly associated with fibromyalgia. The exact relationship between sleep abnormalities and fibromyalgia is not fully understood, but it is believed to be bidirectional, with sleep disturbances contributing to fibromyalgia symptoms and fibromyalgia symptoms impacting sleep quality. Understanding the clinical presentation of fibromyalgia is crucial for accurate diagnosis and effective management. Here are the key aspects of the clinical presentation of fibromyalgia. Widespread pain. One of the hallmark symptoms of fibromyalgia is chronic, widespread pain. The pain is typically described as a dull ache or stiffness that affects multiple areas of the body. It is often present on both sides of the body and above and below the waist. The pain may fluctuate in intensity and may be aggravated by physical activity, stress, or changes in weather. Fibromyalgia can impact cognitive function, leading to difficulties with memory, concentration, and mental clarity. Patients may experience forgetfulness, difficulty finding words, and impaired executive functions. Additionally, fibromyalgia is often associated with mood disturbances, such as anxiety and depression. Tender points. Tender points are specific areas on the body that are particularly sensitive to pressure. Although they are not required for diagnosis, the presence of tender points is a characteristic feature of fibromyalgia. Common tender points include areas such as the neck, shoulders, chest, elbows, hips, and knees. Pressure applied to these points can elicit pain. Fatigue and sleep disturbance. Fatigue is a common symptom in fibromyalgia and can be debilitating. Patients often experience a persistent feeling of tiredness, even after sufficient rest. The fatigue may be accompanied by a lack of energy, reduced stamina, and difficulties with concentration and memory, referred to as fibrofog. Many individuals with fibromyalgia experience sleep disturbances. They may have difficulty falling asleep, staying asleep, or achieving restful and refreshing sleep. Waking up feeling unrefreshed is common, even after a full night's sleep. Sleep disturbances can further contribute to fatigue and worsen overall well-being. Diagnosing fibromyalgia involves a comprehensive evaluation based on the patient's symptoms, medical history, and physical examination. While there is no definitive test to diagnose fibromyalgia, the following steps can help in reaching a diagnosis. Medical history. Begin by taking a detailed medical history, including the patient's symptoms, their duration, and any factors that worsen or alleviate the symptoms. Inquire about the presence of widespread pain, fatigue, sleep disturbances, cognitive difficulties, such as memory problems or fibrofog, and mood disorders. Physical examination. Perform a thorough physical examination to assess for tender points and to rule out other potential causes of the symptoms. Although not required for diagnosis, the presence of tender points in specific areas of the body can support the diagnosis of fibromyalgia. Symptom assessment. Assess the severity and impact of symptoms on the patient's daily life using validated assessment tools. The most commonly used tools include the Widespread Pain Index, WPI, and the Symptom Severity, SS, scale. Rule out other conditions. Exclude other medical conditions that may present with similar symptoms. Conditions such as rheumatoid arthritis, systemic lupus erythematosus, and hypothyroidism should be considered and ruled out through appropriate laboratory tests and imaging studies. The treatment of fibromyalgia typically involves a multidisciplinary approach aimed at relieving symptoms and improving the patient's quality of life. While there is no cure for fibromyalgia, the following treatment strategies can be considered. Medications. Over-the-counter pain relievers, such as acetaminophen, or prescription medications, such as tramadol, can help manage pain. Certain antidepressant medications, such as duloxetine and amitriptyline, can help alleviate pain and improve sleep quality. Medications like pregabalin may help reduce pain and improve sleep. In some cases, muscle relaxants like cyclobenzaprine may be prescribed to relieve muscle spasms and improve sleep. Physical therapy can be beneficial in managing fibromyalgia symptoms. It may include gentle stretching exercises, low-impact aerobic exercises, and strengthening exercises tailored to the individual's capabilities. Gradually increasing physical activity levels can help reduce pain, improve flexibility, and enhance overall well-being. Cognitive behavioral therapy, CBT. CBT is a type of psychotherapy that helps patients identify and modify negative thoughts, emotions, and behaviors related to their pain and fatigue. It can help improve coping mechanisms, reduce stress, and enhance overall quality of life. Stress management and sleep hygiene. Encourage patients to practice stress reduction techniques such as relaxation exercises, deep breathing, meditation, mindfulness, and engaging in enjoyable activities to help manage stress and improve symptoms. Educate patients about good sleep habits and encourage them to establish a regular sleep routine. This may include avoiding caffeine and stimulating activities before bedtime, creating a comfortable sleep environment, and practicing relaxation techniques before sleep. In conclusion, fibromyalgia is a complex condition that requires a multidimensional approach to management. By understanding its clinical presentation, underlying mechanisms, diagnostic criteria, and available treatment options, healthcare professionals can provide effective care and support to individuals living with fibromyalgia. Thank you for joining us today, and we hope this lecture has enriched your knowledge of this challenging condition. And that brings us to the end of today's video. I hope you found the information helpful and informative. If you enjoyed this video, don't forget to give it a thumbs up and don't forget to sign up for a premium membership on our website madeformedical.com for more content like this.